So this is Reflective Journal 4.2. I had to go back and rewatch the live because I'm so behind in all of my classes. Anyways, so all three people have delivered. Amy was the primip. After we get her back into the bed, we'd be looking for placenta separation, respiratory vitals, just overall vitals on the baby and the mom. This is one... I can't remember why I wrote this down now, but it says I wrote down complications that we would be looking for would be potentially giving PIT. I think maybe it was a prolonged second stage. Now I'm trying to remember. But anyways, I immediately was like, oh, I can definitely relate to this in the clinical sense lately. Because we had a resuscitation and a hemorrhage in the same night, and that we were just talking about that or you guys were talking about it in the live. No, I was at the live session. I just wasn't able to do the reflective journal. So the baby that I delivered, it's been probably 2 months ago now, did not really take a good breath, and I did a lot of stimulation and couldn't get her to breathe, and so we ended up doing a little bit of resuscitation on her. And while me and my preceptor were working on the baby, our other birth assistant, who was a certified birth assistant, panicked and didn't do anything, just stood there and watched us. And so I was trying to set up oxygen and get some rescue breaths to this baby and all of those things. And the whole time we kept her attached to her umbilical cord because the baby was born in the bed. And so we just put her between the mom's legs, and so I was trying to set up all that, started giving the baby rescue breaths, and the baby pinked up right away, but she never really had a strong cry the whole time. It was really strange. I mean, she had great vitals by the time she left. Her lungs sounded great. Her pulse ox was good. She ended up staying a little longer at the birth center because of the resuscitation and the hemorrhage, but she was fine. She just never really cried very much. Was kind of strange. And I tried very hard to get that baby to cry. So meanwhile, while we were working on the baby, the placenta's sitting in the uterus, and definitely detached. And, we had, like I said, we have an assistant, but she didn't know what to do. So she's worked there way longer than I have, but she just stood there, and so we were just working on the baby, and then by the time that we got the baby somewhat stable, we had to use a jelly also on the baby to get some mucus up out of her. So we were doing that. Me and my preceptor were going back and forth and using a jelly to suck out mucus. So anyways, after we got quite a bit of mucus out of that baby and got her pinked up, and we used a pulse ox on her pretty soon, we realized that the placenta had been sitting in the mom. And so we were like, okay, she immediately got a bowl and started dealing with that. And as soon as she pulled the placenta out, it just exploded blood. I've never seen anything like that because it was quite dramatic. In fact, it exploded all over her, me, and the baby because the baby sat between her legs. So, it was probably, I would say, at least 250 that came out, clots and blood. So we had the one thing the birth assistant did do was she gave the mom PIT right after the baby was born, which that's kind of her role. She does the transcribe and she does the PIT. So she did take care of those two things. And I'm taking a video, Mattis. Go back in there, please. Shut the door, please. Go. And so anyways, she did do those two things. So the mom did have PIT in her, but it was still quite a heavy bleed. So we massaged her up really quickly, got her firm. And then after that, after probably an hour or so in the bed, we were like, okay, you should probably get up and go to the bathroom because we could feel her bladder was filling up. And when we got her up to walk her, I feel like this is going to take so long. Sorry. We got her up to walk her. She passed out. And right before she passed out, a whole bunch of blood came out. I don't remember how much. I mean, probably 150 at least. And so we laid her down on the floor got her something to eat, got her something to drink, firmed her back up, got her Methergen this time, and got her feeling better. She was on the floor for probably 25-30 minutes, and then went to stand her up again, a whole nother gush of blood, and she passed out again. So at that point, we just decided we need to get her back in the bed. So that's what we did. And we ended up making sure her uterus was firm. It was, and then we started an IV just to make sure, you know, that she got those fluids back, and she was able to go home, you know, I don't know, 6-7 hours after birth. Everything was fine. Everybody was stable. But anyways, that's a big thing to look for, is that anyways. And also we would be checking the temperature on the baby. We need to get the baby skin to skin. Their blood sugar can drop. They can start having respiratory issues. With Bess, we moved to the bed, kept a close eye on the bleeding, and this is when you were talking about the black tub and dropping the baby, which was bizarre. I'm so terrified of ever doing that, dropping a baby, but thankfully, knock on wood, hasn't happened yet. And that is something that I am trying to get better about also, is estimating blood loss in water. Definitely can't do that in a black tub though. With Claire, that was the surprise breech. We'd be checking the hips. I have not had a breech yet, and I'm grateful so far. Had a sticky shoulder the other night and had to have a little bit of help with that. So I hope that I wouldn't panic. I don't think I would, but I don't know. Definitely would want to get a pulse ox on that baby sooner. And with a grand multip like that, I would have heavily encouraged prophylactic Pitocin before in prenatal. You know, like I can usually discuss the prophylactic Pitocin, and I haven't had anybody that were like, absolutely not, I definitely don't want it. We have had some people, multips, precept, or primips, that are like, you know, can we just wait and see? And we're like, of course, you know, if there's an indication, we would like to be able to do it, but you know, if you want to wait and see, that's fine. But with a grand multip, it's very, to me, it's just easy to explain why your risks go up and why it's more of why it's a wise choice. And you know, we always want to remain low risk in the settings that we're at. And I haven't had anyone, I don't think yet, that said no. I did deliver a 46-year-old grand multip sometime last year, and she had virtually no bleeding. I mean, maybe 50. It was incredible. So we actually did not give her Pitocin. There was no reason to. We had it drawn, I think, but we ended up not giving it to her. You know, with that firm of a uterus, it was so firm. Right after the baby was born, it was one of the more phenomenal births I've been to. It was really cool. And so it's nice now, like, to be like, I've delivered a 16-year-old baby, and I've delivered a 46-year-old. So that's my age range right now, which is pretty cool. Anyways, all of these situations are definitely applicable to the clinical situations that I've been in so far. So hopefully I can type up the rest of this tonight and get it submitted. Thanks. Bye.